Hi friends, today I am going to tell about a new eye disease called blepharitis. This is also external or anterior segment eye disease. So first we have to know what is blepharitis. Blepharitis is a common condition that causes inflammation or irritation of the eyelids, leading to red, rimmed sore eyes, sometimes with crusting at the root of the eyelashes. It is extremely common. Respond well to simple treatment, and for most people, it is not harmful. Symptoms includes redness in the eyelids, teeny flakes like dandruff you can see in the eyelashes. The feeling of the sometimes you feel that some dryness is there, burning sensation, grittiness, or you can feel something is in your eyes. And it tends to be a long-term condition, which means you are likely to need ongoing treatment. Severe cases do have a risk of quite causing long-term damage, but fortunately these are quite rare. So now I have to tell you about what caused this blepharitis. It is more common in people who have skin conditions such as eczema and acne, and more common with allergic disease like asthma. Or you can call dry skin, who have the dry skin problem, they suffer for more on disease. Eyelids contain teeny glands that make an oil. I have discussed you about this matter in our previous video, that keep the eyes moist, and it also help us our tear film to stay. But due to some blockage which cause irritated eyelids and dry sore eyes, because the glands opening are blocked, therefore the oil couldn't secrete it properly, therefore the tear film stability is gone and your eyes become dry and it becomes too vulnerable to any bacterial infection. So dandruff like flakes build up to the base of your eyelashes, and in some people blepharitis is partly caused by the sensitive to bacteria Staphylococcus aureus, which bacteria already stay on our skin. The risk factor: blepharitis is more common in people over the age of 50, but anyone can develop. This is often because the glands make the normal tears, particularly the oily part of the tears, tend to become less effective as you get older. Now the most important part, the treatment. The most important treatment is a good eye care or lid hygiene. And this should be used twice a day, even when the symptoms are not there, to prevent the condition causing further problem. So first, warm compress. Boil some water, let it cool little, or use water for the hot tap. Water should be hot but not enough hot to burn your eyes. Soak a cotton wool or clean a flannel in the water. Wring it out gently, pressed into your closed eyelids. Just gentle closed eyelids for 2 to 3 minutes at a time for one eye. This melts the oily secretion blocking. This melts mainly the infection is happened there. So if you done this type of cleaning, the blockage will clean automatically. And soften the lash flex. Massage your eyelids by gentle rolling by first finger or over the circular motion, or running the length of your finger. You can go for a circular motion, or you can do this type of massage also into the lids margin, okay, and do it in a cotton or weighty cotton, not from your hand. Use a moistened cotton bud to gently clean inside or back edge of the eyelids, then more firmly scrub off and flake of their bases of your eyelashes. This is the best done in the front of a mirror. You can own. But first what you have to do, wash your hand before and after cleaning your eyelids. Rub the moisture pad cotton ball firmly but gentle along the eyelid's edge to remove the crusts and debris. Take care of wipe between the eyelashes of both the upper and lower lids. Use a fresh pad or wipe each time. Dry your eyes gently. The eye specialist may prescribe you some antibiotic drops or ointments, artificial tear drops to read out from the symptoms, which is burning sensation, grittiness. Occasionally to give you symptomatically improvement. Report antibiotics, mouth or steroid drops also your eye specialist can give you. Actually, if you feel this type of symptoms, better to go for an eye specialist and check by the eye specialist. Now the complication part. Blockage of the gland can lead to chalazion, meibomian gland cyst, leaving around patches, painless patches under the eyelid. Sometimes this can be red and sore to start with. Most disappear within a few months without treatment. To help the cyst to warm, compress can be used. Much less commonly, blepharitis can lead to change the clear window of the front of your eye, which will usually require further treatment and checkup. So friend, goodbye.